Hello, I'm Zachary Fury, and this is my friend James Taylor.
This is our science project on the deadly disease Ebola, which first struck in Zaire, Africa in 1976.
The virus was named after the Ebola River in Zaire, Africa.
It is in the Filiviridae family with an incubation period of 2 through 21 days.
It is related to Marburg fever and rabies.
There are 5 different strains of Ebola. The 5 different strains are named after the 5 first places they attacked.
Ebola Zaire, Ebola Sudan, Ebola Ivory Coast, Ebola Reston, and Ebola Bundibugyo.
Now follow us into Miss Miles' classroom where we will discuss the history of Ebola, including from where it first attacked to current events.
In 1976, Ebola was first discovered in Zaire, Africa, although the disease originated in monkeys from the Philippines.
There are 284 cases and 151 deaths.
Also in 1979,
There are 39 cases and 22 deaths. In 1994, several monkeys from the Thai forest were found infected.
also African gold mines were infected, causing 52 cases and 31 deaths.
In 1995 and in the Republic of Congo, 315 cases were reported and 256 deaths.
By 2005, 1,800 people have been infected with Ebola. 1,200 have died.
2005 and in the Democratic Republic of Congo, another major outbreak occurred.
There were 264 cases and 187 deaths.
In that same year in Uganda, 187 cases were reported and 131 deaths.
Recently, Ebola has still been a threat. Since July of 2012, there have been 17 deaths.
Next stop, Ebola's causes and how it originated.
Here we are showing you the causes of Ebola.
Ebola is one of the 4 filament-like viruses.
This means that the disease is like a string.
Ebola is originated from monkeys, but can travel to humans and even domestic pigs.
All strains of Ebola are passed through liquids such as vomit and blood.
The virus caused massive hemorrhage from every orifice of the victim's body. This makes Ebola easy to spread from people to people, so doctors have to be wearing protective clothing when operating on a patient.
One doctor got Ebola because a patient threw up on his body.
One strain of Ebola, Ebola Reston, not only travels through liquid but also through air, making it even more dangerous.
Fortunately, Ebola Reston is not fatal to humans.
Once Ebola gets into a patient's bloodstream, there is no stopping the effects.
This makes doctors have to use extreme caution when operating on a patient.
Ebola causes will make it very lethal and easy to spread through families and hospitals.
Next we'll be discussing the symptoms and how dreadful and deadly they make Ebola. Here you will see the symptoms of Ebola and how it affects the body.
After the first few days, patients would be experiencing a worsening headache. Also, fever, weakness, and muscle and joint pain come about. Also, the patient's eyes turn red.
Within 1 or 2 days, the disease reaches full strength, which brings chest pain, bloody vomit, and diarrhea and sudden weight loss.
Massive bleeding also occurs from nose, mouth, eyes, and every single pore on the patient's body.
Also, sores on the lips are detected. Even the intestines may fill up completely with blood.
The patients bleed like a squeezed sponge.
There is so much bleeding, the patients could drown in their own blood.
Also, the patient keeps on throwing up even after their stomach is completely empty.
The organs turn to liquid and stop functioning.
The liver turns yellow, cracks apart, and goes putrid.
The kidneys become jammed with blood clots and stop functioning.
This causes the blood to become toxic with urine.
The spleen turns into a blood clot the size of a baseball.
Some patients go crazy because the virus attacks their brain.
In an Ebola patient, death usually occurs 5 to 6 days after the infection entered the bloodstream.
The Ebola virus is one of the closest viruses to a zombie infection.
The reason why is because of the blood and the insanity the patient goes through.
All of these symptoms are what make Ebola the deadly killer.
Next, we'll be discussing a few ways of diagnosing Ebola.
Unfortunately, diagnosing Ebola quickly is difficult.
That is because the early symptoms of Ebola are very much like other early symptoms of different diseases.
Those diseases include malaria, influenza, and typhoid fever.
Doctors should ask patients about current medical conditions, symptoms, family history of medical conditions, and current medications.
The doctor should perform a physical exam for signs and symptoms of Ebola.
The only sure way to diagnose Ebola is with a blood test.
Now follow us to explore the treatment of Ebola. This chicken may remind you of chickenpox, but unlike chickenpox, there is no vaccine for Ebola.
There is no cure either. The only treatment is giving oxygen, blood, or other fluids to the patient.
The patient is isolated, so he or she cannot infect other people.
It is hard to search for a cure for Ebola.
The reason why is because in Ebola is a biosafety level 4 hot agent.
This means that the highest level of security must be used when studying this disease.
Next, we will be discussing the prognosis of Ebola.
Now we are going to tell you about the prognosis of Ebola.
Unfortunately, with Ebola, 50 through 90% of patients die.
This makes Ebola one of the most fatal diseases in the world.
Survival is not in the patient's favor.
Even if the patient survives, he or she will have blindness and or hearing loss for the rest of her life.
Now we are going to discuss the future of Ebola. As you can see from the CNN website, Ebola could spread to the U.S.
Luckily, Ebola has a hard time spreading to industrialized countries.
Ebola could be used as a bioweapon, though.
So in the future, Ebola will still be a threat to mankind. The nature of Ebola makes it hard to predict the threat for future generations.
Next, we will be hitting the highlights of Ebola.
Now we're going to go over the key points of the Ebola virus.
There are 5 different strains, and it was first discovered in Africa.
It is a string-like virus related to Marburg fever and rabies.
Ebola has devastating symptoms that can easily cause death.
Few patients survive.
This disease is hard to study because it is so lethal.
There is no cure, and patients must be isolated so as not to infect other people.
Using Ebola quickly is difficult.
In the future, Ebola could be used as a bioweapon.
People are still going to die of Ebola in the future. It is one of the most deadly diseases ever.
But thanks to modern science, a cure and a vaccine are being worked on.
Now we've completed our science project.
Thank you for watching.
Thanks.